Friday. I hope all your prayers come true, especially the one about getting A in this course. As well, I want to thank the previous groups for a wonderful presentation. And making our hearts confused somewhere between smiles and tears. So let me quickly introduce my awesome team. We have worked together to bring you this presentation today. The presenters are myself, Leila, along with Ayman and Azam. Oh, sorry. Yeah, okay. So let's focus on one of the big issues that many adolescents face today. Okay. Before this one, ladies and gentlemen, before we dive in our topic, please tighten your mental seatbelts and sip your milk. Milk doesn't just build bones, it will spring Wi-Fi. No government today. Hosting this. Any idea to say that words? I want milk. Adolescence is a phase of life between childhood and adulthood, between age 10 and 19. It is a crucial phase that's lying on between, for a foundation of good health and prevent long-term health issues. So, based on 2021 situation analysis and NHMS 2022, there are five key domains challenging the adulthood here in Malaysia, which are education, skills, employment, enabling and protective environment, health, participation, and challenges. So our topic today will focus more about adolescent nutrition. So before we go, please scan the code, enter Slido, and we'll have some fun together. So now, which is the following do you think is the most common nutrition problem among Malaysians? It's adolescents. As usual, most of us facing different conditions. Okay, so most of you said overweight and obesity. Let's see if it's right or not. So in our presentation, we'll focus on these main parts about nutrition issue, causes and reasons, intervention, then we will conclude. So let's go first, look to the results of NHMS, which done 2022. It shows there's a higher prevalence of overweight and obesity among adolescents, and more of thinness among urban areas. And there is overweight and obesity more in rural area like Sabah and Sarawak. And also in rural area they have a mixed prevalence in males and females. So now we'll talk about the nutrition issues. The first one will concentrate on undernutrition and hiding hunger, then on overnutrition and lifestyle imbalance, body image, media influence, and cultural norms. So if we concentrate about undernutrition and hiding hunger, we'll focus on stunting and chronic undernutrition, then iron deficiency anemia, and the hiding hungers. So about the stunting, it is a chronic undernutrition, which is happening in early life phase. So it can cause a long-term delay in cognitive development and academic performance. It is morely high prevalence in rural area like Sabah and Sarawak, and also in among Orang Asari population. So if we go through the global and national situation, in global situation in 2022, approximately 148 million of children who are stunting. And WHO aimed in 2023 to reduce this number to 89 million. If we look to a situation in Malaysia, the prevalence of stunting among adolescents decreased from 10.4 in 2012 to 6.8 in 2022. So now, iron deficiency anemia, it's a common form of nutrition anemia among adolescents, especially in females, due to menstruation and inadequate dietary intake. In global situation, there is over 1.6 billion adolescents who are suffering from iron deficiency anemia, as I said, mainly in females. In Malaysia, in 2019, a survey done among adolescents who are from 15 to 19, they reach 20.5 who are suffering from iron deficiency anemia. Mainly in females reach 34.1 compared to the males which got 9.6. They called it as a silent pandemic. Hiding hunger, it's mainly about the micronutrition deficiencies. So if we talk about vitamin D, it's common due to lack of sun exposure because of indoor activities or cultural clothing. Calcium because of low dietary intake. And for the zinc and folate deficiencies, it can impair the immune function and reproductive health. So, global situation, over 5 billion people who have inadequate intake of micronutrients. In Malaysia, there is a study done between 2019 to 2020 in children aged from 4 to 12 years. They found 3.1 having vitamin A deficiency and 25.1 having vitamin D insufficiency. In girls, 35.2, in boys, 15.6. So previously we were worrying more about undernutrition and micronutrient deficiencies. Nowadays we are more worried about overnutrition and lifestyle imbalance. So raising overweight and obesity rate, as I said before, it's rising, and sedentary lifestyle and healthy school food environments. So this graph shows that in 2016, Malaysia is the second highest country who have the prevalence of obesity among children aged 5 to 19 years. Here, the surveys done in 2023 and 2022 shows the same results. It's the highest prevalence of obesity and overweight among adolescents. This is due of lack of intake of essential foods, high consumption of sweetie drinks and fatty foods. WHO recommends to do a physical activity, especially in adolescents, at least 60 minutes each day. But unfortunately, in 2022, survey shows 3 in 5, they are not doing any physical activity. If you can see, through 2012 to 2022, the percentage of lack of physical activity increased to reach 66.7 compared to who's doing a physical activity 21 point. So about the nutrition, the survey shows also there is lack of consumption of fruit and vegetables. Only 13% of adolescents who is taking 2 servings of fruits daily, and only 3% of adolescents who is taking enough milk per day. Unfortunately, they are consuming high of sugary and sweetie drinks and high fat sugars. So now let's focus on a case study done in a school environment, especially in a school canteen by Azizan and others. They found in this study the student still buy unhealthy food, still drink high sugary carbonated drinks, still dislike to take fruit and vegetables, and this can affect on the sale of the food vendors and their profits. This is because of lack of student understanding of benefits of healthy foods. So this is my point. I will ask my colleague to continue from here. And the floor is yours. Thank you.
Very good evening, everybody. So I will continue with the presentation. So what the first part of the presentation basically telling us what is the issue. So overnutrition, undernutrition. So in my part, I will tell how does this issue actually manifest in the society, in what form, and then we'll go a bit deeper into what is the causes of this issue. So I will particularly touch on 3 items, which is how does it manifest? Like I asked, is in terms of meal skipping, disorder eating pattern, how social media fuels body dissatisfaction and overeating, and how does sometimes our cultural belief and festive food practices actually influence or fill up on this issue. So meal skipping is one of the things. So there's a lot of information here. So basically, how does overnutrition or undernutrition reflects in the society and affect the society? For example, one is meal skipping. So when in pursuit of thinness due to time constraint, some of the society prefer to skip meal. Of course, the objective is to reduce weight. But of course, this comes with a lot of disadvantages and dangerous health effects, such as low energy, poor memory, reduced overall nutrient intake, and some research by Norima et al. Actually stated that girls who skip meal more likely to experience low self-esteem even. So again, the intention was to lose weight. Sometimes people have poor appetite after waking and also lack of time in the morning. So disordered eating pattern, this is also how the overnutrition or undernutrition manifests in the society. So I think we are quite particularly familiar with anorexia nervosa, bulimia. Have we heard anyone in our friends or among our family having bulimia? So basically bulimia is a combination between binge eating and then after she eats, she physically induced vomiting. Just because he feels that it will not, the thing that he ate will not go into his body in terms of the calorie. So this is also disordered eating patterns. And then how social media fuels body dissatisfaction. I think nowadays we are bombarded by media most of the time, binge eating, food review, especially during festive season, Ramadan, it's all about food. And particularly if we see there's research says that study shows that people exposed to high calorie food image, 25% of them actually will eventually increase their food intake by itself. Exposure can lead to 34 increase in snacking, especially of unhealthy food. So is this something that we need to particularly take a look at, because our generation is the first generation. For the younger generation, it will be worse for them. So we really need to take care of it. And then cultural belief and festive practices, like I said, we have multicultural society, we have a lot of events, we have a lot of festive, after Raya, after Christmas, Chinese New Year, after Chinese New Year, and then the Karazan, the Iban celebration, and each of them come with their own food, their own festive. So in Malaysia, it could be contributed to our issue and our standing in the term of obesity ranking in Asia, for example, maybe. So let's take a look of the fact. High calorie food. Research shows that food portions are often large, and social norm encourage adolescents to eat more out of respect. I think during our childhood, our mother reminds us not to waste food, to eat food, and especially when you go to your grandmother's house or your festive friends during festive, they'll say that you eat food in order to respect them. If you don't eat it, it's like you don't like their food or you disrespect them. So it's not. I think it's in our culture. So in terms of the taboo pantalarang, dietary taboo, during menstruation, for example, there is a belief where adolescents shared during menstruation, mother and grandmother would instruct them to avoid protein-rich or cold food, even they felt physically well. This is something of the cultural items. So I guess we'll take you on another exercise. You can scan the barcode. So I guess the question is trying to shed light on dietary habit. I see Dalgona coffee, McDonald's in the morning, Olive. Maybe something not that particularly nutritious, but could be convenient. Maybe that's the reason why we change our diet. There's actually another slide after this where it stated that how urbanization actually causes our diet to change, and maybe this is one of the symptoms. And then after we explore a bit on how does it manifest in our society, then the next slide will go into what is the actual reason of the causes of this phenomenon. So what causes these nutrition issues? From economic status point of view, food insecurity, urban lifestyle, media, peer influence and body image, and how the school system, lack of education and labor illiteracy actually contributed to this issue. So economic status, logically, people can assume that if someone comes from a very quite low economic status, then we can assume how does their diet actually reflects in terms of do they prioritize nutrition than convenient? Do they prefer something that is easy, processed, or in comparison to something organic? And of course, do they prefer something that is just as long as it's cheap, they'll take it instead of something that is much more pricier like dairy or organic food. So low-income households, particularly those in B40 group, often prioritize quantity over nutritional quality due to financial constraint. Let's take one example. NHMS 2024 report that B40 households experience high level of food insecurity and low dietary diversity. And the research say that found that food insecure adolescents and had significantly lower intake of energy, protein, fiber, folate, and vitamin C. And another research say that low-income families tend to consume more processed food, rich in salt and sugar, contributing to poor health outcome. And then how do they cope? Because of their economic status, they have low economic status, for example, how do they cope? Some say that some families eat fewer meals per day, reducing portion sizes, prioritizing food for children over adults, especially mothers. And NHMS 2024 confirmed this behavior are widespread among B40 households. And according to Sulaiman et al., such strategies are commonly used and contributed to malnutrition and increased health vulnerability. And then how does the impact of rising food prices? They are already having low economic status, and then in addition to that, rising food prices, how does it affect them? Some skip meals, some substitute healthy food with cheaper food. Some report says that food price inflation leads to reduced consumption of fresh produce, and also unstable income exacerbate food insecurity among vulnerable population. And lack of refrigeration and food storage facilities, of course, maybe in Malaysia, I'm not sure is it really prominent. Maybe if we look to our neighboring country, maybe Indonesia or Philippines, that is really B40. I think in Malaysia, even if our B40, we can, I think most of them can afford refrigeration and everything, but maybe in another country, it's another issue. So many low-income households lack of refrigeration, limiting their ability to store perishable food like dairy, vegetable, and meat. So leading them to consume more food high in sodium, sugar, and saturated fat, low in nutritional quality. And another one research stated that food insecure adolescents had lower diet quality and consumed significantly less fresh produce. And how does it impact their health on food security? Chronic food insecurity leads to various negative health outcomes, of course. Stunting, obesity, like you mentioned in the first part of the presentation. One research reported that adolescents from food insecure homes had an average health index 56.8, which is very low, indicating poor overall diet quality and food insecurity, according to Sulaiman, leading to mental stress, compromised nutritional intake, and increased risk of chronic illness. Okay, so the next slide we will see into what urban lifestyle actually cause or change our dietary habits. So according to Adolescent Health Survey, 55.7 was found to be higher adolescents being hungry in Kuala Lumpur, 5.7, found to be higher than the overall national prevalence, 3.9%. So if we see the explanation below, nutrition status of urban adolescent, individual, household and neighborhood factor based on data stated that prevalence of overweight and fitness among sample of 1,030 adolescents was 21.9% and 4.6% respectively. Evaluation of diet quality and associated factor among adolescents in Kuala Lumpur stated that majority respondent, 80.7%, were at risk of poor diet, and another item stated that rural to urban migrants often shift their diet, reducing staple food like maize and increasing intake. So that might explain our survey earlier in the question why there's quite only less people that consume whole food and some option to choose like 3-in-1 coffee, McDonald's, something that is easy, maybe because of the urbanization and the place that we live in. So urban lifestyle, expansion of supermarket and fast food chain in mainly concentrated region with urbanization, parents with busy schedule, causing them to rely on fast food and convenience culinary like instant noodle. Adolescents eat out a lot more, often choices driven by taste and affordability. And urban poor household tends to rely on diets high in refined and processed sugar and fewer fresh staples. Okay, so this one stated that how media and influence body image. I think we are quite familiar in this issue. Someone that make their benchmark of physical attractiveness, they will see from the media, see from their ideal, someone that they adore in the media. So it actually shapes their minds, wanting to become like that person. So the media most influential contributor of social acceptance norms. So female actually experience high level of body image dissatisfaction than their male counterparts. Strong association between media exposure and body image and high degree of body image dissatisfaction and diet will have lower self-esteem. I think there's a funny video a few years ago that said that women, even though sometimes they are very pretty, they will always say that I'm not pretty, I'm not pretty. And male, no matter how they look, they will always think that they are not that good. maybe this is the explanation. So media peer influence and body image, media food advertisement, like we mentioned earlier. We are bombarded with food review, with food programs, so we actually shape our mind, causing some to increase their food intake. I will not go into details. Media peer influence and eating behavior. So peer influence on eating behavior may extend from in-person influence to social media influence. Previously peer pressure, what we call, in school, leading them to behave in a certain way, but in a social media time, so the peer pressure is more towards like the individual want to join another group, want to become one group, so they even up to a level they change their way, their diet. Social media may influence poor eating habit, maladaptive eating behavior, behavioral intention of eating fast food with advertisement, peer endorsement of fast food and soda, user sharing tips and strategies for extreme dieting and extreme eating behavior. So next we go how the school system actually plays a role in this situation. So there's a school untapped potential where school fail to prioritize nutrition, a major opportunity or infers dietary habit is lost. Lack of coordinated multi-sectoral approach weakens support children's rights to adequate food and health. I think it's particularly more obvious in Malaysia because our school system or school diet system is more adjusted to profit. So we don't really point on nutrition that much. So school potential with inconsistent food policies, which causing how poorly nourished students may struggle with concentration. School system that don't support healthy diet contribute to the cycle of poor nutrition and educational inequality. School meal program, lack of access to school meal leads to skip meal. Food insecure area leads to worsen malnutrition and missed opportunity to school meal to drive local food production. Nutritional education is also lacking. It's not embedded in the curriculum where students lack knowledge to make, perform or inform food choices. So education and dietary behavior, as a summary, basically the same. We don't emphasize education on healthcare or health food intake in the curriculum of our students. So this is something that needs to be corrected. And labor illiteracy, so basically, if you purchase a food, not much of us that want to take a look at the label very particularly. Sometimes we are influenced by packaging, by what our peers say is good. So label illiteracy needs to be corrected as well. Okay, last slide. Not last slide, last survey. So as Minister of Health, which program will prioritize formation teams? So most of you said that free breakfast in school, some mandatory nutrition education, ban of junk food, TikTok campaign on body image, something to be discussed. Free breakfast in all school. I guess we'll discuss it at the end of the presentation, which one is better. There's no right or wrong answer, obviously, for this issue. Okay, for the next slide, I'll proceed to Sunday. How was samosa? And then I think one of my good friend got a special food, make something. What's it called?
Samosa.
After samosa, what is that? I think it's nice, right? Okay. So let's go to our topic. So my previous colleagues discussed about causes and then the case scenario in Malaysia. I'm going to discuss about the intervention. Alright, so good afternoon everyone and thank you. So I will continue from the previous presenter to explore practical intervention aimed at improving adolescent nutrition in Malaysia. We often say prevention is better than cure, and this invitation reflects that spirit. Designed not just to treat, but to transform adolescent health outcomes. Right, based on this study, 2022 Adolescent Health Survey, we clearly see that standalone efforts are no longer enough. What is needed a well-coordinated strategy that integrates policy, school, families, and even digital platform. Like anything, you can see evidence looks as a team. Now the anime Thunderbolt. So we have to work as a team. So working as a team, policy as a team, then only we can tackle this problem. Alright, so to do this, we're going to see on the SEM approach. First, when we talk about policy level, we're going to talk about national frameworks like HCIS and suppletive regularization. Then community, we're talking about B40 gardens, food preservative innovation. International, we're talking about health canteen policies, school clinics, audits. Interpersonal, we're talking about parental workshop, peer campaigns, and individual, talking about nutrition, education, My BFF at school, and diet tracker apps. Alright, so this is a repeat from the song. Let me go in. So when we talk about the possible nutrition one, when we talk about school nutrition education, we are talking about the most fundamental, where teachers have to train students to make a informed decision on what they want to eat. Right? It's not about banning about junk food, but talking about how we are going to do informed consent. Which food is good for our body, which food is good for our brains. Right? Then we talk about school canteen policies. School canteen is more than a lunch life. It's a front line of health. Enforcing healthier food options and reducing processed sugary items can make a major impact. Regular audits ensure compliance and encourage consistent quality. So this one, we can help students to reduce undernutrition and hypernutrition as well as overnutrition. So there's this program called HIDS. What's HIDS? Is Healthy Meals in Schools. Alright? It's an excellent model. It provides balanced meal that covers 20 to 30% of the students' daily nutritional needs, and it implemented with the support from school nutritionists and health officers. The goal is simple: to full academic performance to good nutrition. Alright? And then this is another plan. This is the super smaller model, divides into
1/4 of carbs, 1/4 of protein, and half fruits and vegetables. It's a straightforward, visual way to teach balance. So there's a school called SMK Sirikota in Malaya successfully adopted this approach, showing that changes is not just possible but practical. Alright. We also gain signs from other countries. Japan and South Korea provide balanced meals with strong nutritional oversights. Meanwhile, England, Singapore, and the US focus on limiting sugar and increase whole foods. Malaysian policies are aligned, but there's a room to adopt successful global practice, especially around meal quality, monitoring, and student engagement. Parents are key allies. Throughout workshop, culture, tailored guides, and community events, we can bring nutritional elements into home. When family and schools are aligned, adolescents receive a consistent message about health. So it's not only that. Because we eat home food when as kids, I think, in our age, we always go home and eat food. But nowadays, no, we go for KFC, McD. After school, I see my nephew and nieces say, let's go for KFC, McD. So it's because of we did not align them about proper nutrition. So being a parental, we need to engage this community because we're the second stage, first close encounter to them. The way we eat, our child will learn. Alright. And then, clinic kesihatan remaja can be strengthened to include routine nutrition screenings and personalized counseling. Supporting this will mobilize mobile diet apps, make the process more engaging and help to identify and address issue early on. Digital campaigns. Okay. So, social media is a powerful influence on adolescents. Campaigns like Eat Smart Malaysia, influencer-driven content can shape peer norms. When eating healthy habits become relatable, shareable, we can create a momentum for real behavior changes. So, yes, as now phone is a big influencer for us, Facebook, Instagram. So, using this type of channel platform, we can improve healthy diet in adolescents. Alright, and this is the information on 6. We also need to think about access. Shared gardens in low-income areas, along with low-tech food preserving methods, help to reduce waste and make fresh food more accessible. This community level efforts are essential for food security, especially in rural areas and under desert zones. So growing plantation in B40 compounds. So this one will prevent us using chemicals, fertilizers and all that. So this will help us to improve overall nutrition. Alright? So this is the part that everyone is waiting for, conclusion. Alright, to conclude, adolescent nutrition in Malaysia is a complex issue, but not an unsolvable one. The dual burden of undernutrition and overnutrition requires a multi-dimensional approach. Education and policy reform, community-driven programs, digital engagement tailored to youth. By working across these layers, we will not only nourish our young people, but we prepare them to thrive. As the message goes, empower you today, healthier nation tomorrow. Thank you.
Adolescence is a phase of rapid physical and psychosocial growth. Optimal nutrition is essential to achieve optimal growth in both aspects. Survey has shown about 8% of Malaysian adolescents are stunted. Adolescence is a vital period for musculoskeletal development. Balanced diet containing both macronutrients and micronutrients are essential to prevent stunting in adolescents. Adolescence is a period where there is an increased demand for nutrients, marked increase in muscle mass. 45% of adult bone mass is achieved during adolescence, and 15 to 20% of adult height is achieved during adolescence. Poor nutrition could be because of their behavioral changes during adolescence. Harmful nutritional behaviors also emerge as adolescents start making nutritional choices independently from their parents. Adolescents get more good satisfaction from anything they find enjoyable. There's an increased drive for rewards and reduced self-regulation, leading to a pattern of unhealthy food choices. Poor nutritional intake may result in impaired cognitive development and reduced learning capacity, reduced lifetime earning potential, poor immunity and frequent illness, undernutrition, and negatively affects chondrogenesis or the growth of the bone. Micronutrients such as calcium, phosphorus, zinc, Vitamin D, vitamin A, vitamin K and protein in food support optimal bone growth. When diet is deficient in essential micronutrients during puberty, optimal bone growth and elongation will not be accomplished. Calcium supplementation in girls aged between 10 to 18 years has been essential for achieving optimum bone mineral density and hence preventing osteoporosis. Milk consumption is essential to improve bone mineral density, especially in young girls. As such, healthcare providers should proactively educate early adolescents and their parents about expected growth, nutrition requirements throughout the adolescence. Healthcare providers should also offer nutritional counseling for adolescents, regardless of their weights on total diet approach. Healthcare providers should encourage adolescents to get most of their nutrition from unprocessed food. Preventive measures by healthcare providers and parents are vital for optimal adolescent nutrition.
Right, that was a message from Dr. N. Diaga. This is a senior consultant, pediatrician and adolescent medicine specialist in Hospital Sultanah Bahaya, Kedah. So this is a message from one of a dietitian. So can you all guess who is the dietitian? Yeah, so this is a message from one of the classmates. Oh, there's a key for you. Who was that?
Not milk, huh? You guess. Who guessed it? You guessed.
Yeah. Right. Thank you very much. CP.